Hi, so today we're going to talk about what a cataract is. And a cataract is simply a clouding of the natural lens in the eye. So in our eyes, we have lenses. You can think of them like camera lenses. These lenses are clear when we're babies, but as we get older, they age with us. And then once they are no longer clear and they begin to look brown or cloudy, we call the lens a cataract. Now, there are many things that can lead to clouding of the lens. So obviously, as a part of the natural aging process, this can happen. However, there are certain disease conditions in the body that can be associated with more rapid growth of cataracts. So diabetes, for example, trauma to the eye, for example, both of these things can be associated with cataracts at a younger age. Sometimes getting cataracts at a young age runs in a patient's family. So by getting cataracts at a young age, what I mean, the typical age that we see cataracts, maybe 55 and older, but most commonly people are in their 60s, 70s, 80s. I even take care of plenty of patients in their 90s that have had very slow growing cataracts. And as they've gotten older, they haven't bothered them until much later in life. Cataracts grow at different rates in different people. So there is no way to predict if your doctor tells you that you have a clouding of your lens. There is no way for us to predict how quickly that clouding is going to progress to ultimately affect your vision and require cataract surgery. Basically, when a patient has a cataract, that's okay as long as you can see well. So what I tell my patients is patients are ready for cataract surgery when you don't see well anymore. So if you're happy with your vision, you're able to see to do the things that you need to do. For example, you can see to read, drive, especially driving at night. That's one of the things that's most commonly affected first when a patient develops cataracts. As long as you can do those things okay, it doesn't matter that you have a clouding of your lens. The point is that you can see to do what you need to do. However, when you start to not being able to see to do the things that you need to do, and your doctor cannot make your vision better with glasses, then it's time to see an eye surgeon about having cataract surgery. Cataract surgery is a very simple and straightforward procedure these days. Cataract surgery in my hands, for example, takes approximately 6 minutes. For most cataract surgeons these days, less than 10 minutes is the case. When we remove the cataract, what we're doing is simply removing the natural lens from your eye and replacing it with an artificial lens. You'll hear that as the lens implant. This is because when we take the natural lens out of the eye, we have to put an implant back in order for you to be able to see well. If we don't put an implant in your eye, then you're going to be needing some very thick glasses like patients used to wear in the 80s, for example, prior to us having lens implants. So a lens implant is simply an exchange of the brown lens in your eye, or cataract, for a new clear intraocular lens. Now, this intraocular lens is going to be with you for the rest of your life, and you have choices on what this implant is. There are several choices, and depending on your personal situation, for example, whether you have astigmatism or not, your doctor will present these lens options to you. So the good thing about having cataract surgery is that if you are a patient who would like to be free of their glasses. So, there are many people who don't want to wear glasses anymore, don't want to wear them for distance, don't want to wear them for near, don't want to wear them for anything. This is your time in life to have that corrected. We have lens implant options. We are putting your glasses prescription inside the eye in a little lens implant. You can think of it like a mini contact lens. You don't feel it, you don't know it's there. It just allows you to see to do the things that you need to do. Your doctor should be presenting you with options for this lens implant. There are options that can correct astigmatism, and there are lens implants that have bifocals in them that can even help you to see up close. What's very important to all of us these days is when we look at our cell phone or tablet, for example, or computer, as you're doing now, you don't want to have to be reaching for your reading glasses every time you pick up that cell phone or look at that computer. And we have lens implant options that can help free you from that. We can have you free of your glasses for about 95% of things you do if you are an individual with a healthy eye. So, as I said, every person's situation is individualized to that person, and you need a healthy eye exam to determine where you stand. So cataract surgery is not something to dread, it's something to look forward to. Typically, it's performed in this country one eye at a time. So one eye is done, and then approximately a week later, or whatever day that you decide that's not the same as the first eye, we do surgery on the next eye. Typically, most surgeons will have you use eye drops for 2 to 3 weeks following surgery. And typically, you can drive within 24 hours. And yes, your vision will be a little blurry for a few days after surgery, but with a healthy surgery, your vision should clear up very quickly. What can you do to prevent cataracts? Well, I've said that it's a natural aging process of the eye, but definitely you can slow that progression down and maybe become one of those patients who are in their 90s needing cataract surgery, or maybe never needing cataract surgery. When you're in the sun, you need to wear good sunglasses. Sunglasses with 100% UVA and UVB protection are very important because not only do they help delay the progression of cataracts, they help protect our retina, which is the part of the eye that's processing our vision information and sending it to the brain. Think of the cataract, which forms from the lens in your eye, as the windshield of your car, and think of the retina as the engine. And so those sunglasses help to protect the engine. They help to prevent damage to the back of the eye. In addition, they also help to prevent damage to the front of the eye. So we can get skin cancer on our eyes. And think of your sunglasses as your sunscreen. Can't put sunscreen on your eyes, so we wear it in the form of sunglasses. So you can get squamous cell, basal cell, melanoma. Same things that can happen on your skin can happen on the surface of your eye. I treat these all the time. So wear your sunglasses. The other thing is that you need to maintain a very healthy diet. So our eyes are not separate from the rest of our body. So antioxidants, having the proper amount of vitamins and nutrients in your diet, we've all heard about the healthy things that we should eat, and we can help you more with that if those are things you have questions about. But a cataract is essentially an oxidation process in the eye. Think of it like a rusting car. And to slow that oxidation process, then you need to have good, healthy fuel going into your body. So you want to put premium fuel in your car. You want to put premium fuel in your body. Treat your body like a luxury car. So having healthy nutrients, wearing your sunglasses, maintaining a healthy body, keeping your blood sugar controlled. Diabetes is one of the things that will very quickly lead to cataract progression. High levels of blood glucose will very quickly oxidize that lens and lead to the need for cataract surgery. So good blood sugar control is needed for many reasons, not just to prevent cataract progression, but to prevent diabetic eye disease and to prevent problems with your kidneys and your nerves and all of the things that diabetes does to the body. So that's cataract. Cataract is a clouding lens in the eye, the natural lens in the eye going cloudy as we get older, or as we have a trauma or some other medical issue that accelerates that growth. And that's how we take care of it. We remove the cloudy lens and replace it with an intraocular lens implant in outpatient surgery that just takes your surgeon usually less than 10 minutes to perform and get you back to your daily activities. What can you not do after cataract surgery? We don't like you to swim for about a week. There's no stitches typically placed in the incision. At the time of cataract surgery, we close that wound with water to allow it to seal. And so we don't want you to get an infection. So no swimming or putting your head under the water for a week after cataract surgery. No lifting heavier than about 10 pounds for a week. The reason for that, again, is that there are no stitches in the very tiny incision that is made to enter the eye, and we don't want any increased pressure to the head to open up that wound. Again, you can drive usually within 24 hours after the anesthesia has worn off. You do need to listen to your eye surgeon as to when they recommend that you can drive again. And most people can tell that there's an improvement in their vision within a few days after surgery, but definitely by a week and out to a month after surgery, you should be noticing that you're seeing a lot better after your cataract surgery. If you have any questions, feel free to reach out to me. You can schedule an appointment by calling my office at 304-721-4003. We're on the web at www.cataracttreatment.com. info@bellasea.com, or you can shoot me a question in the comments below. Thanks so much. Bye.